Good morning, or good afternoon, or I should say. Welcome to this public witness hearing on American Indian and Alaska Native programs under the jurisdiction of the Interior Environment Appropriations Subcommittee. Especially want to welcome distinguished tribal elders and leaders testifying today in the audience. Most of you have traveled a long way to be here this week. I hope you'll seize the opportunity to meet with other members of Congress outside of this subcommittee to remind them that honoring the nation's trust obligations is a responsibility shared by all members of Congress, regardless of our state or congressional district. I can assure you that your voices are heard by this subcommittee, but we need your help to continue to build awareness and support amongst our colleagues here in the House of Representatives. For those new to the process, today's hearings are just a start of a dialogue we've come to depend upon to help us make smart choices in the budget and to earn the votes of our colleagues. Be assured the American Indian Alaska Native programs will continue to be a nonpartisan priority for this subcommittee, just as they've been in recent years under both chairmanships of both Democrats and Republicans alike. Before we begin, I have a little bit of housekeeping to share. Committee rules prohibit the use of outside cameras and audio equipment during the hearings. The hearings can be viewed in its entirety on the committee's website. An official hearing transcript will be available at gpo.gov. Each witness will have 5 minutes to present testimony. Your full written testimony will be included in the record, so please don't feel pressured to cover everything in 5 minutes. Finishing less than 5 minutes may even earn you a few brownie points, so don't be shy about that. We'll be using a timer to track the progress of each witness. When the lights turn yellow, the witness will have 1 minute remaining to conclude his or her remarks. When the lights blinks red, we'll ask you to please stop. We'll hear from every witness on each panel before members will be provided an opportunity to ask questions. Because we have a full day ahead, I request that we try to keep things moving in order to stay on schedule and respect each other's time. I'm sure many of you have planes to catch later today, so we want you to get that. With that, I thank you all again for being here, and I'm happy to now yield time to the distinguished ranking member, Betty McCollum, for her opening remarks.
Thank you, Mr. Chair, and I'm so proud that this committee under your leadership has continued this public testimony from our tribal nations, and with that, I am anxious to hear what they have to say.
Great. Thank you very much. And with that, I think I'll recognize Mr. Floyd, James R. Floyd, Principal Chief, the Muscogee Creek Nation. You're recognized.
Good afternoon, Mr. Chairman. Thank you, Congressman McCollum. I appreciate the time. Did submit written testimony, and I won't cover that again. Unfortunately, I think most of my time this afternoon may be going for healthcare issues, but I do feel it's important to raise them for the committee. Particularly concerning to Muscogee Creek Nation is the decision back in January by Centers for Medicaid Services and Medicare and Medicaid Services to designate tribal governments as a racial group. We find that particularly offensive. Muscogee Creek Nation, we've had a government-to-government relationship with the United States with our first treaty back in 1775 in Georgia, and we've continuously had those through 1906. And so we find that extremely disturbing to us, and to be considered a racial group, I think, just undermines the integrity of the both legal and government-to-government relationship that has been experienced for 240 years approximately. So taking that into practice, yesterday the governor of the state of Oklahoma signed the work requirement on Medicaid. Oklahoma, I think it's a 40% match of federal funds to state funds, and for American Indians, it's 100% pass-through. So we did speak with our legislators during this process. Unfortunately, the bill passed. It was signed yesterday. Where it hits us particularly hard within the Muscogee Creek Nation, and I'll talk about that in a minute further, is in counties such as McIntosh County, Oklahoma, where we're just completing a joint venture program with the Indian Health Service to build, to have the clinic, which will be open in July. McIntosh County, Oklahoma is either the first or second highest unemployment county in the state of Oklahoma, between 9 and 10% regularly. And we're going to be crippled in that county, in that new facility, with resources from the outset, due to the fact that we're going to find citizens reluctant to apply for Medicaid with a work requirement when there's no work there in that county. So extremely frustrating. I urge the committee to take a deep look at that and would be glad to provide more information as necessary on that. The second point that I have today deals with contract support costs, and we're grateful for the 18 appropriation. I'm not going to complain about that at all. The area that I feel that needs attention is for us specifically, as well as contract support costs. As a growing healthcare system, we rely on contract support costs, and to see that that being not fully funded is causing us a problem. It's unfortunate, and I regret to say this, but we did retain an attorney and file suit against the department, the Indian Health Service, and in a matter of backlog claim of $94 million with the Muscogee Creek Nation. And so we hated to take legal action, but after 3 years as principal chief, I've not even had a response from the area office, the regional office, or here in Washington. And so we felt that we had to take it to the next level and address it. And it just kind of indicates that there's no decision-making vertically within the department in regard to this matter. So I think that something maybe this committee should take a look at, urge you to take a look at that, because it needs to be addressed so that there aren't others in similar situations, which I'm sure that there are. Ours is just a long-standing, growing issue. And third, I'd just like to ask that the committee look at the expansion of the joint venture program. I know that Chief Baker's here, and he's going through a joint venture program with the Cherokee Nation. We're about to finish a joint venture program in McIntosh County in the town of Eufaula, where that joint venture has allowed us to go from 5,000 square feet to 70,000 square feet. Being a self-governance tribe, we do have the resources that we could easily support 2 more joint venture projects in Okmulgee and Sapulpa, Oklahoma. And we just feel that it needs to be opened up for tribes who do have the resources to engage with the Indian Health Service. I think it's a way that we can raise a level of health care for all American Indians. Sir, with that, I'll conclude my remarks.
Thank you very much. Appreciate that. Cynthia Boone, with the council member of the Osage Minerals Council. You're recognized.
Oh, do I start over? Go ahead and start over? Sure. Okay, thank you. Good afternoon, Mr. Chairman and members of the subcommittee. My name is Cynthia Boone. I'm a member of the Osage Minerals Council. We are an 8-member governing body for the tribe that oversees development of the Osage Minerals Estate. I want to start by thanking each of you for including $3 million in the new funding in the 2018 omnibus for BIA to plug abandoned wells. In most places, the BLM does this work, but on our reservation, the BIA is responsible, and the work was not getting done. Our mineral estate is one of the oldest oil and gas fields in the United States. After almost 130 years of continued development, there are about 2,000 unplugged abandoned wells on our reservation. These wells are an environmental and health hazard. Some are near schools and playgrounds. We are meeting with the Bureau of Indian Affairs this week to ensure that this $3 million in new funding gets put to work plugging wells on our reservation. We also support your request for an inventory of unplugged abandoned wells under BIA oversight. This inventory will show that the BIA needs additional funds in fiscal year 2019 and beyond to plug these wells. BIA has already identified 1,602 wells that need plugging. 1,400 of those have already been identified as a priority. Some are poorly plugged and need repair. Based on our experience, it costs $10,000 to $100,000 to plug an abandoned well. In fiscal year 2019, we request an additional $5 million to continue this work. BIA needs serious funding to address this health and safety liability. BIA's failure to plug abandoned wells is just one example of the shortfall of the BIA energy budgets. BIA lacks the funding needed to support development of Indian energy resources in the best interest of Indian trustees. We all know that Indian energy development creates jobs and supports tribal, regional, and the national economy. In 2015, it was estimated that the Osage mineral owners would receive about $14 billion in royalties over the next 15 years. That's about $1 billion a year. Imagine the economic impact we could have if the BIA was properly funded. BIA's energy budget should be increased by 10 times to provide the staff, expertise, and resources to support Indian energy development. These increases would give us the petroleum engineers, accountants, and professionals we need to manage the Osage Minerals estate in the best interest of the Osage. Unlike other tribes, the 1906 Osage Allotment Act creates special legal requirements for leasing on our lands. Interior also has Osage-specific leasing regulations. The Bureau of Indian Affairs is the only agency involved in approving oil and gas permits for our minerals estate. The BIA does not get any help from the BLM or the Office of Natural Resources Revenue. The Osage Minerals Council also has unique management responsibilities, but our funding is limited as well. We currently manage the estate with an annual drawdown from royalties that should be distributed to the minerals owners. Meanwhile, ever since the year 1921, the state of Oklahoma collects a 5% gross production tax on our minerals that are held in trust for the Osage. In many years, the state collects more than $5 million from this tax, but provides us with no benefits. With this impact from state taxes and many responsibilities for managing the minerals estate, we request that the subcommittee provide direct funding to the Osage Minerals Council to help us hire the staff and experts we need to manage the estate and promote drilling and production. As highlighted in our written testimony, we need about $2 million in funding to hire experienced staff, create a digital database of well production, and monitor environmental hazards. We also ask that the subcommittee take action to sunset the office of the special trustee and return its staff to the BIA as Congress originally had intended. OST was created to guide Interior through the Cobell litigation. That litigation is over, and OST now has taken a role advising the Bureau of Indian Affairs in the management of our minerals estate. The results have been disastrous. Our minerals are no longer managed in our best interest. Now they are managed according to OST's mission, which is to limit the liability of the United States. OST served its purpose. It's time to return these accounting positions to the BIA, where they can simply oversee the electronic accounting systems created to manage the Indian revenues. Finally, we ask the subcommittee refuse to fund Secretary Zinke's interior reorganization until he consults with Indian tribes on his plans. It has been more than a year since Zinke announced his reorganizational plans, and not a single meeting has been held with the tribes. Every single executive order and tribal consultation policy requires early and often consultation on issues affecting Indian tribes, and for good reason. Tribal involvement is needed to make sure that any reorganization is a success. Thank you again for the $3 million in new funding in fiscal year 2018 to plug abandoned wells. This is a health and environmental liability that must be addressed, and I am available now to answer any questions that you may have.
Thank you.
Brownie points?
Yeah. You had about a second left. Good for you.
Does that mean you're going to write me a check?
Good point. Melanie, you are recognized for 5 minutes. Melanie Forkiller, Policy Analyst, National Tribal Contract Support Cost Coalition.
Thank you, Mr. Chairman and members of the committee. My name is Melanie Forkiller. I'm with the Choctaw Nation of Oklahoma, and I'm testifying today on behalf of the National Tribal Contract Support Cost Coalition. The coalition is comprised of 21 tribes in 11 states and administers about $500 million in IHS and BIA programs on behalf of 250 Native American tribes. Over the past year, we've seen IHS now and BIA implementing their new policies as a result of full funding for contract support costs, and we clearly want to recognize your efforts in making that a reality. We do, however, have some concerns with how particularly IHS is moving forward with implementing their policy. First of all is the grant-making matter. IHS has taken a recent pattern of moving recurring appropriations of a certain type over into competitive grant making. Unfortunately, what happens when that occurs is that contract support costs are not paid on such funds. Grants are not eligible for additional contract support costs. Grant bureaucracies have to be constructed both on our end as well as the federal side to administer these grants. So we particularly were encouraged with the language that came out in the 2018 appropriations that urges IHS to consider moving those into self-determination awards. We've yet to see how IHS will respond to that language, but we will be watching that carefully. We're also concerned about IHS's contract support cost policy. Back in December, IHS unilaterally, without tribal consultation, suspended a portion of the policy dealing with how to determine duplication in funding. They were unable to provide data that really supported, we think, the rationale for making that suspension. However, the contract support cost work group came together and together found a consensus amendment that they would recommend to the acting director of IHS to address IHS stated concerns on that. IHS has now issued a 30-day consultation on that amendment to the policy. However, at the same time, also sent out 2 additional options that were developed by IHS themselves without tribal consultation for consideration as well. So we're somewhat concerned that IHS may choose to do something that has not been recommended by the tribes. A last example that I'd like to share with you is the larger matter of determining duplication between contract support costs and direct program funds. There's been a fundamental dispute between Indian Health Service and the tribes in terms of how that's to be done. And unfortunately, after all the years of not receiving appropriate funding and contract support costs, now IHS is often taking the position that they're paying us too much in contract support costs, which is ironic. So unfortunately, their position is really an extreme one, eliminating whole categories of contract support cost rather than taking an amount offset for a duplication. And so what it's forced tribes to do is either accept IHS's position on this or sue IHS, and that's what some tribes have chosen to do. Unfortunately, if tribes don't have the resources for a long court battle, IHS, fairly wins on those matters. So we often remind IHS that they're required to facilitate the transfer of program services, functions, and activities to the tribes rather than putting up barriers or making it difficult or undermine the ISDA. So in contrast, I just want to quickly note about BIA. Their process on the converse is very streamlined and efficient, and we have no comments or issues with BIA at this time. So while we've made a lot of progress, we've got some way to go. The ISDA is the clearest support of the government-to-government relationship I've seen in a statute in my lifetime. Unfortunately, with the HHS recent determination that tribes are instead a race-based classification rather than government is totally unacceptable. So we're going to continue the dialogue with HHS to correct this ill-fated or ill-determined decision, and I wanted to express my particular gratitude to the bipartisan effort that you all have made to support us on this matter. Thank you.
Thank you. We're going to recess in a minute and then come back, I think, probably for questions because we only have like 1 minute left in the vote, so I guess we ought to go vote. But so if you'll stay right here, Tom will be coming back to chair, and I've got something else I got to do this afternoon, and I'll be back. I promise, Betty. Okay. So we will recess for a moment. Thank you.
we can, we'll reopen the hearing, and I want to thank our guests for indulging us. You get paid to vote around here, so we needed to go, and thank you for letting us do that and coming all this way. I just want to make a couple of quick remarks, and then whatever questions my good friend and colleague, Ms. McCullum, cares to. First, I really want to thank you, Chief, and I did this earlier this morning, for bringing up this really lamentable CMS decision on defining tribes as racial categories as opposed to governments, which they clearly are. And as I said earlier, and I'm going to put this in the record multiple times in the next couple of days, a lot of us have protested that on a bipartisan basis very strongly. My colleague, Ms. McCullum, and I co-chair the Native American Caucus. We've got a letter circulating. I think our chairman has signed on to that as well. So there's a lot of Republican and Democratic angst over this. I sent the legal opinion from our tribe there, and I know other tribes have certainly done the same thing. I just think there's absolutely no justification for that. And it, you know, if you want to be generous, you can say it bespeaks of an ignorance about the nature of the relationship, and that would be putting it as kindly as you possibly could, quite frankly. So I just want to assure you, and I won't pretend to speak for every member of this committee, although I suspect I do. On a bipartisan basis, we'll push really hard back against that. I'm not exactly sure how we'll proceed. I happen to have CMS under my jurisdiction and under committee, and one way or the other, we're going to make it clear that Congress on this has a very, very different view than this particular agency does. To be fair to HHS, they've said they're reconsidering this. They're taking it, they're looking at it again, so I think the pushback is helpful, and I would just encourage all of you, whether you're here representing a tribal nation as you are, or you're representing an organization as Four Killer as you are, then I think this is a really important one for Indian country to be very united in their voice. And so the more they hear, I just think the better off we are in terms of them understanding that. Ms. Boone, I hope we do continue down this road of providing money to do the environmental cleanup that we're obligated to do. I mean, we're a trustee of those resources for the tribe, and I thought your suggestions were excellent across the board. So, again, it's always tough. I know this is going to be a static budget, so we'll see what can be done, but I think there's considerable sympathy here, and thank you for fighting so hard on contract support. You shouldn't have to fight so hard. We've gone to Supreme Court and won this thing once, twice. Yeah, that ought to be enough. It's and then to make people jump through hoops to get what the Supreme Court says the federal government's obligated to, I think, is really not appropriate. So hopefully we'll continue to be, and I know this committee will continue to be very supportive of your position and very anxious that we fulfill our obligations under the trust relationship. So thank you very much. That I yield to my good friend from Minnesota.
Thank you, Mr. Cole. I just wanted to echo the comments that Tom made on CMS's decision. It's an outrage, and it's one that unites us on the chamber speaking up and speaking out on it. I know, as Mr. Cole said, particularly on this committee, cleanup costs, making sure that, and I appreciate the EPA sometimes is not the most popular conversation to have in this committee or with some of my friends on the other side of the aisle. But having money for cleanup in communities and neighborhoods is vitally important, because when this toxicity sits around, it doesn't get any better, it only gets worse, or if it becomes diluted in the area it's in, it means it spread the pollution some other place. So thank you for bringing that up. Two things have kind of come to mind in what some of the testimony has been on consultation. One is on the reorganization that Secretary Zicky's looking at. We brought it up. We have, I think, I'm not stepping out of line, saying we have some concerns going forward. We want our questions answered on a whole host of issues, but tribal consultation is something that has come up on that. And I think we're setting up a call for me to speak with him next week, and before the call happens, I'm going to send him some things that I'm concerned about so he knows ahead of time so we can have a fruitful discussion. But I really think we need to have a face-to-face discussion with at a staff level and then at a member level about where we're going on this. There's just too many questions. It's too much money, and it can cause too much disruption. The other thing that I came up with, and Mr. Colme, and I think our staffs will probably work on this together. You know, I'm wondering in some of these authorizations, if the authorizers wrote a program with the intent that it would be formula driven, right? And then all of a sudden it'd be changed to grant. That's not how Congress authorized something. So I've asked our staffs to kind of work with our folks over at the Library of Congress that do our research for us to find out how these authorizations went through. What was the legislative intent in that? And that might be one way to address them. They might be different. They might be written differently, but we won't know until we do our due diligence on it. So thank you for bringing that up. With that, Mr. Chairman, I yield.
Thank you very much, and our witnesses are excused. Thank you very much. Again, thank you for your patience. Thank you. You bet. And if we could, we'll bring our next panel forward. Jefferson Keel, the President of the National Congress of American Indians, which is a pretty important title, but the Lieutenant Governor of the Chickasaw Nation is a much more important title. And then we have the Principal Chief of the Cherokee Nation, good friend and great leader in Indian country as well, Chief Bill John Baker. It's good to have both of you here as my friends and friends of this subcommittee. So if we can, Lieutenant Governor Keel, we'll start with your testimony first, then Chief Baker, we'll go to you.
Thank you, Mr. Chairman. I really appreciate you and Ranking Member McCollum holding this, and it's good to see you again. On behalf of the National Congress of American Indians, I thank you for holding this Native Public Witness hearing. We in Indian country have appreciated the fact that members of this subcommittee have worked to protect the federal trust and treaty responsibility and the obligations in the budget in a nonpartisan way. We urge Congress to restore the eliminations and reductions and build on the increases made in the FY 2018 Omnibus Appropriations Bill. Tribes seek only those things promised to us and every citizen by the Constitution and the solemn treaties and agreements reached between our tribal nations and the United States of America. At the founding, the United States dealt with our tribal governments as sovereign entities and sovereign equals. In exchange for federal protection and the promise of certain benefits, our ancestors gave up forever to the people of the United States title to the very soil of our beloved country. The proposed budget cuts to tribal services, if enacted, would represent a clear retreat from the federal commitments and treaty promises made to the tribes. Yet the 2019 President's budget for Indian Affairs would be a 15.6% decrease from the FY 2018 CR level. Nearly every line item in the BIA budget would see reductions in the FY 2019 budget request. NCAI urges Congress to reject the steep reductions in the BIA's proposed budget and instead invest in the programs ranked as most in need of increases as a part of the 2019 tribal budget formulation process as described below. As part of the FY 2019 budget formulation process, tribes identified the top programs needing increases. Unfortunately, most of these programs would receive reductions in the 2019 President's budget request. 4 programs in the top 15 identified by tribes were proposed to be eliminated in the President's budget: scholarships and adult education, housing improvement program, the Johnson O'Malley program, and small and needy tribes. I want to address some of the top areas identified in the budget consultations. For public safety and justice programs, Indian country faces funding shortfalls in a number of areas, while at the same time facing increased need due to a climbing trend in drug use. The BIA submitted a report to Congress in 2016 estimating that to provide a minimum base level of service to all federally recognized tribes based on recent appropriation levels, BIA is generally funding tribal law enforcement at about 20% of estimated need, tribal detention at about 40% of estimated need, and tribal courts at 3% of estimated need. In 2016, OJS had an increase in methamphetamine seizures of 106% over the year before, and an increase in opioid seizures of 56%. With about 30 BIA criminal investigators nationwide, to address that, the opioid and meth trends require a much higher level of staffing to adequately address the issue. NCAI recommends an increase in funding for BIA law enforcement and detention of $353 million for FY 2019. Similarly, BIA social services help to address the underlying conditions such as drug addiction, poverty, and violence that tend to create and perpetuate the circumstances that produce victims. Sub-activities include services in the areas of family and domestic violence, child abuse and neglect, protective services. However, many tribe social services departments are understaffed and experience high turnover rates. With child welfare, the ICWA funding is the foundation of most tribal child welfare programs. Even after recent increases in FY 2015, current funding levels fall far short of the need estimate. The need for every other program identified in budget consultations has similar levels of shortfall. NCAI urges Congress to invest in these areas as well as providing an overall increase to the BIA's budget to support the base budget for core tribal programs. Related to proper consultation, NCAI requests a pause on the reorganization of Indian programs, including BIA and the BIE, Bureau of Indian Education, for FY 2019. A pause on the reorganization is required because proper tribal consultation has not begun yet. We have not seen any. Finally, tribal leaders strongly oppose, as you've heard from other tribal leaders, and I'm sure you'll hear it from across the country, tribal leaders strongly oppose CMS's misinformed suggestion that tribal governments have a racial rather than political status. This suggestion is inconsistent with tribal sovereignty, the U.S. Constitution, Supreme Court decisions, and long-standing recognizing the government-to-government relationship between tribes and the United States. I thank you, and we look forward to working with this subcommittee on a nonpartisan basis to protect the federal trust and treaty obligations in the budget. Once again, thank you for your consideration, and I'll be happy to answer any questions.
Thank you very much. If we could now, Chief Baker, we'll move to you for your testimony.
OCO, thank you so very much for having us here today, Acting Chairman Cole and Ranking Member McCollum. It's good to be here. I'm Bill John Baker, Principal Chief of the Cherokee Nation. Thank you for the opportunity to share our appropriations priorities for fiscal year 2019. The Cherokee Nation is truly one of the great success stories in Indian country. 50 years ago, our annual budget was $1.1 million. Today, we have an economic impact of over $2 billion. We are the undisputed economic engine in the region. Our government is increasing access to quality health care, education, jobs, and housing. Our businesses are employing men and women across the United States, including in each of your districts. However, there is much work to be done. The Cherokee Nation is not in business simply to be in business. We're in business to serve our 360,000 citizens and to give them and every resident in northeastern Oklahoma the opportunity to create a better life. I believe the first step to reach this goal begins with excellent health care and education. We are currently building a new health facility under the IHS Joint Venture Construction Program. When it opens in 2019, this new 469,000 square foot facility will be the crown jewel of the largest tribally operated health system in America. The center will provide primary care and integrated behavioral health, preventative care, and a wide array of medical specialties. We are finalizing negotiations with Oklahoma State University to bring a new medical school to the complex. It will be the first medical school located in Indian country. This project is critical to the future of healthcare in the Cherokee Nation and our region, and I cannot say enough about its importance. IHS shares this view. The President's fiscal year 2019 budget request included $159 million for staffing and operation cost for newly constructed healthcare facilities. This funding will support staffing and operations at 7 new IHS facilities, including ours. We applaud the administration for prioritizing funding for our facility. Today, we urge the subcommittee to support and fully fund the administration's request for fiscal year 2019 appropriations bill. Moving to education, I am pleased the subcommittee directed the BIA to investigate establishing joint venture construction programs for schools that are modeled after Indian Health Service joint venture program in last year's spending measure. As I've testified previously, Cherokee Nation strongly supports the creation of a joint venture program for schools. We operate a BIE school that is in dire need of repairs, and we cannot continue to wait for the agency to work through its way through a long list of schools with similar needs. I encourage you to continue to push BIA toward innovative solutions to address the significant construction backlog. Finally, I thank you, Congressman Cole, and Ranking Member McCollum for the efforts to address CMS's incorrect decision to classify tribal governments as a racial group. We strongly oppose this ill-conceived action. It undermines tribal sovereignty, ignores Supreme Court decisions, and long-standing policies that put federal-tribal relations on a government-to-government basis. Our health budget relies on Medicare reimbursements to care for at-risk users. In 2017, Medicaid patient visits totaled more than 94,000 at our facilities. Without Medicaid reimbursement, we would lose as much as $46 million this year alone. I urge the Appropriations Committee to take prompt action and exercise oversight through the fiscal year 2019 appropriations process. Such oversight should emphasize the government-to-government relationship between the federal government and tribes and direct CMS to revisit the incorrect decision. Thank you again for this opportunity, and I'm happy to answer any questions you might have. Waddell, I almost gave you 30 seconds back.
Well, he was doing that for all of Indian country.
That's right.
First of all, I want to thank both of you, both wonderful friends and great leaders in Indian country, and I want to thank both of you for your testimony and for coming up today. And let me start first, if I may, Chief Baker, with you. You mentioned this issue. I mean, we're all focused on the sovereignty question on the CMS decision and the misunderstanding of the constitutional relationship between tribal nations and the United States government that shows, but you also focused on the very real financial impact it would have. Can I just ask you, because I know how much you've invested, Cherokee Nation has invested in the health of its people, really a trust obligation of the United States. So how much are you already putting into your health care on top of what the federal government provides?
In the last 5 years, just in construction, over $300 million. Yeah. But then we do contract or purchased health is what they call it now. We subsidize it each year. I could get you the number, but it's a huge number, but it's the most important thing for our people.
Yeah, no, I'm not critical at all. It's interesting to me. Almost every tribe I've seen that can do something like that does do it. I mean, that's the point. But we had testimony on one of our earlier panels today where somebody made I think it was the Quinault chairwoman made the point of how much of the cost of the trust obligation they were picking up in a relatively small tribe, and certainly in the largest tribe in the United States, the Cherokees are picking up an extraordinary amount of money.
Several hundred
already
million.
doing. So, then to add on this Medicaid, I'm not against work restriction. I actually favor them, but not at the expense of tribal sovereignty. And let's sit down and let the tribes work out what works best for them. They can make that decision, but certainly don't want to cost them anything they're getting from the federal government when they're already where they can, putting in a great deal of their own resources on top of that. It's an extraordinary achievement. If I can, let me, Lieutenant Governor Keel, and turn to you real quickly, and then I have one other point, and I'll turn it over to my friend. You mentioned the opioid crisis, and we all face it, and it's interesting. In every panel we're on, no matter what the jurisdiction is that comes in, I don't know if we could do this or not, but we put a lot of new money in FY18 into opioids, actually on the Labor H Committee, and this committee's certainly done what it can within its jurisdiction. How advisable, in your view, would be, and again, Ms. McCollum and I have tried to do this in a couple other areas. We try to get set aside, set up. Sometimes we make it, sometimes we don't. Took a while. We finally got one. The authorizers get a little testy about that when we try to do that on these bills, but that may be something we look at in Labor H. That's where most of this extra money in FY18 and 19 has come, because we've got to have some way to target this where tribes do get the appropriate share. So I would invite you to work with us, through the National Congress of the American Indian on that, and sit down and see if we can together think through what an appropriate formula would be, and at least get the precedent in, and then we'll see if my friend and I can hold off the authorizers and get them to understand this is a pretty good thing to do.
Well, if I may, and thank you for the question and comment. The fact is that the $50 million set aside is great for Indian country, and we definitely appreciate that across the board. The problem that we have in 2018 is that we're just now getting the funding appropriated or out to the tribes. It's got to be expended or spent by 30th September. So, we got about 3 months, and the money's not even out there yet. We're talking about a grant program. So what you're going to see, in all honesty, is there are going to be tribes that have great grant writers. They're going to write these grant proposals, and they're going to get funded. And the fact is that there are going to be tribes across the country that don't necessarily have a grant writing capacity. They're going to be left out. So we've got a problem in how we get these monies to the right place. For next year, for 2018 or 2019, that problem will be reduced, and we'll be able to handle it a little bit better. But I certainly would love to sit down, and I know we've got staff and other folks across the country that would love to sit down and talk about how we come up with a formula-based program to meet those needs. But, with methamphetamines years ago, we had the same type of crisis in Indian country. And, this is not the first time we've talked about it. With opioids, it's a little different because we're talking about prescription medications as well as other illegal things. So it is a different type of thing. But with any time, it's been my experience, when we talk about having a war on this, we're going to have a war on meth, we're going to have a war on opioids, but we don't expend the resources that we do when we go to war, like another country. When the United States goes to war, we put all of our resources together with a mindset of we're going to go and win this war, whatever it takes. We don't do that when Indian country. We say we're going to have a war on this, and we're going to airdrop money in different places, and we all compete with one another to try to get those funds. So it's a difficult process to work through.
And this is probably being wise out. In fact, we had the same problem that you mentioned of big appropriations near the end of the fiscal year in defense. I know there, because I sit on the Defense Appropriations Subcommittee, we literally sat down with the Pentagon as a committee and assured them we were going to provide them flexibility because we didn't want them to overspend and waste money and then lose the money. And it's probably something we should have, maybe still can look at in some of the other areas, because we don't want you to lose the authority, but we also don't want bad decisions to be made and then people come back and point to them and use them as an example of waste when we all know here there's tremendous need. With that, I want to turn to my good friend, the gentlelady from Minnesota.
Well, I think you covered just about everything, and we look forward to working with NCAI, as they pull things together, and with individual tribes with their needs. So I want to thank you for that. But when we've been talking about the lack of tribal consultation and the Department of Interior's reorganization, focus has kind of been on the Bureau of Indian Education and the General Bureau as well too. This is going to be something I'm going to put towards GWIFLEC, which is in the northern part of the United States with the tribal organizations that work on fish, water, and quality of environment issues. But I've also heard from other tribal organizations that they're very concerned about what the Bureau is doing and what's happening at the other bureaus, Bureau of Land Management, Fish and Wildlife Service, and the impact it's going to have on tribes if they're not fully consulted. Would either one of you gentlemen want to expand on that, or maybe because of where you're at and the focus of your tribal testimony, maybe you haven't gotten into that? Do you want to expand on that at all?
Well, in terms of reorganization and tribal consultation, there's been no consultation across the board, no national consultation. In the spirit of tribal consultation, consultation should occur before a decision is made to undertake an action. This hasn't happened. And I don't want to be too negative, but we talk about this, announce and defend. We make an announcement, this is what we're going to do. They bring it to Indian country, say, what do you think about it? You know, how you like this? And then they defend the position to do whatever it is. In terms of reorganizing the interior, and I've spoken with Secretary Zinke, and he's explained his thought process and what he would like to see, or his vision, and he compares it to a fish or a salmon going from one place to another, and all the agencies that are involved in regulating that. My point is that tribal governments are not fish. We're not part of the Fish and Wildlife Services and all those things. We ought to be involved in how we interact with federal agencies and at what level, and how we want to conduct businesses on our lands, on our terms. So we do believe that we should be sitting down with the Interior and with those other agencies to talk about a concept of how we get from one point to another. You know, and I liken it to going to the moon. Everybody wants to go to the moon, but you got to build a vehicle to get you there. And so we've got to plan to get from point A to point B, and do it in a reasonable and safe way.
Well, thank you, and I think that's a good analogy, because you bring in a lot of different types of engineers, right? When you're constructing that engine,
Yes.
You just don't bring in one engineer, and then you do a couple tests and you talk about it, and then you roll it out. So I'm not opposed to looking at doing something for the future. Change is always difficult, but change is going to be done where it's the most effective, and it's moving forward for the next, 3, 4, maybe 7 generations. Then everybody has to be part of the discussion. So thank you very much. Thank you, Mr. Chair.
Ma'am, we haven't even talked about the cost of the reorganization and the types of costs that would be incurred just simply reorganizing one agency, much less an entire.
That's one of my questions to the Secretary. Thank you.
Well, I thank both of you for your testimony. Appreciate you coming all this way. Chief Baker, I know you'll be as close to paradise as you get back in northeast Oklahoma tonight. I suspect Lieutenant Governor Keel and I will be stuck here. So, anyway, good to see both of you again. Thank you. If we could, we'll have our next panel come up, please. You can just sit wherever you want. I want to thank both of you for joining us today. We look forward to your testimony, and if we could, we'll start with Mr. Tuber, the Chairman and President of the Alaska Native Tribal Health Consortium. You're recognized for 5 minutes for your opening statement.
Thank you, Congressman Cole and Ranking Member McCollum. Microphone. Sorry. Good morning, or good afternoon, Congressman Cole and Ranking Member McCollum. My name is Andy Tuber. I have the great pleasure of serving as the chairman and the president of the Alaska Native Tribal Health Consortium in Anchorage, a statewide organization that serves all 229 of our tribes serving members exceeding 166,000 at this point. I also have the great pleasure of serving as the president and CEO of a primary care organization in Kodiak, Alaska, in the Gulf of Alaska, where we deliver a host of services both under the health banner and also the social and human services banner. I want to acknowledge and thank this committee for its work toward providing substantial funding increases for the Indian Health Service budget in FY 2018, and in particular the increases to the maintenance and improvement and sanitation and facilities construction line items. Both of these programs are extremely important for Alaska Native communities and the Alaska Native and American Indian people. Despite the considerable increases provided last year, additional resources are still needed for both of these programs due to the backlog of unfunded programs that have accumulated over the years. I'm going to limit my testimony today to addressing the IHS Healthcare Facilities Construction Program. In 1999, Congress directed the IHS to work closely with Indian tribes to review and revise the healthcare construction priority system. Congress recognized and noted that several issues needed to be considered in revising the priority system, and that, quote, a more flexible and responsive program can be developed that will more readily accommodate the wide variances in tribal needs and capabilities, close quote. While the IHS does have a healthcare construction priority system, it does not include the innovative approaches to facilities construction that Congress may have expected at the time. This is one of the reasons that Congress continues to encourage the IHS to examine alternative means of financing and delivering healthcare services to Alaska Native and American Indian people in appropriations report language. According to the IHS 2016 report to Congress on healthcare facilities need, over half of the IHS-owned healthcare facilities are over 30 years old, and the average age of IHS hospital is over 40 years old, nearly 4 times the average age of private sector hospitals. And unfortunately, the number of antiquated IHS facilities is only going to get worse unless alternative approaches to funding them are taken. At the recent rate of IHS healthcare facility construction funding, a new facility that were to be built today in 2018 would not be scheduled for replacement for over 400 years. The IHS report estimated that a total of $10.3 billion would be needed for construction of adequate healthcare facilities to serve all Alaska Native and American Indian people. The estimated cost just to complete the 13 inpatient and outpatient facilities currently on the IHS planned facilities construction list is approximately $2.1 billion. At the current level of funding for IHS healthcare facilities, it would take 20 years to complete construction of the existing list before any funding would be available to address the other $8.2 billion needed for facilities construction. In Alaska alone, there is a need for $2.16 billion for healthcare facility construction, and there are no Alaska facilities on the existing construction priority list. As no funds are currently provided to IHS for renovation or expansion of existing facilities, the current system leaves most IHS areas, all of which have very old facilities, without a way to improve them. Again, I commend this committee for the substantial maintenance and improvement funding increase in 2018, which ensured that all IHS areas had access to some funding toward adequately maintaining IHS and tribal facilities. However, continued future maintenance and improvement increases of the same magnitude are needed, as historically the funding for IHS M&I was insufficient for even basic maintenance and repair deficiency needs. This underfunding has led to a backlog at the end of 2017 of nearly $515 million for deferred maintenance, alteration, and repair. An additional approach to ensure that all IHS areas have access to resources to address facility needs would be to establish and fund an area distribution fund as authorized by the Indian Healthcare Improvement Act reauthorization in 2010. The establishment of an area distribution fund would fund for the renovation and expansion of existing healthcare facilities would provide funding for all IHS areas and also help to address the dire unmet need to renovate and expand IHS and tribal health facilities to provide more efficient and better care to Alaska Native and American Indian people throughout the Indian country. This concludes my remarks. Thank you for the opportunity today to provide testimony, and I look forward to answering any questions.
Thank you very much for your testimony. If we can, we'll now go to Miss Megan Alvana, is it Stimful?
Stimful.
With the Norton Sound Health Corporation, the gentlelady is recognized for her testimony.
Good afternoon. Wanga Megan Shukshak Alvana Stimful. Aguva Mulhurunga, Sitnasak Mulhurunga. I'm a King Islander, and I'm from Nome, Alaska, in the Bering Strait, where the United States is neighbors with Russia. And so where I'm from, a lot of our cousins are over on the Russian side, and I come from a really culturally diverse area where Inupiaq, which spans from the Bering Strait region all the way to Greenland, and then south of us is Yupik, and then on the other side is Siberian Yupik. And so it's a really busy time of year where I'm from. All the men are out on the ice hunting, and they bring home walrus and seal, and so me and my sisters, we were up late cutting meat, and my mom actually made a really good meal, which I had never had before, but it's walrus breasts. It's really good. And so anyhow, I moved home from D.C. after a decade here working for Senator Murkowski to make sure in my adult life I do that. I learn where I'm from and my language and everything. So anyhow, it's an honor to be here because not only, I want to thank you for the important work you do for tribes and Indian country on a lot of the issues that Jefferson Kill raised, they impact our communities too. As the nation considers its dialogue on opiates and responding to it, I want to remind this committee that, since nearly the founding of this country, alcohol has impacted Indian country in devastating ways. That as we figure out the focus, we need to make sure we put 100% of our focus on substance abuse treatment in our Native communities. The Norton Sound Health Corporation Board has prioritized substance abuse treatment, and we realize that, we can't go to a facility like it's any facility in Washington, D.C. or anywhere else in the lower 48. It has to be relevant to who we are and where we're from and how we live. And the beautiful thing is that where I come from, we still live our way of life on our lands. We haven't been relocated. We can talk about access to fish and wildlife, but that's another conversation. So Norton Sound Health Corporation has prioritized the construction of a demonstration project that would treat substance abuse, so providing inpatient services, alcoholism treatment, which, none of our facility, can provide, none of our facilities provide that direct treatment to care. And for us to complete the building, we need $9.6 million, $9.6 million. And we're hoping that this committee can explore using a demonstration project within, let's see, it's Section 307 of the Indian Healthcare Improvement Act. And we feel that we're building a model to address substance abuse that will be relevant to Indian country, because all of our tribes have culture and language and place, and we have to be able to heal from substance abuse that way. The issue of historical trauma, which is, the trauma that's transferred through generations after what happened with the relocation and all these issues, language loss, the federal government played a huge role in that. And the federal government is going to play a huge role in our healing. And that's, one of the things that I hope this committee continues to focus on. And so you'll see my written testimony for all the bullet points and the facts. But, in my community, 92% of cases involving child relocation, alcohol is involved. 95% of referrals to the women's shelter, alcohol is involved. 95% of our men and women that are incarcerated, alcohol is involved, and that's a $5.7 million cost to our state. So if we can focus our resources on addressing substance abuse, we will save a lot of public service dollars. The last issue I want to talk about, I have 39 seconds here, is sanitation. I want to direct the committee's attention to actions of the Indian Health Service, which I believe are a direct assault to the federal trust relationship. It's changed the way it's interpreting the Indian sanitation manual, which directs sanitation services, and it's treating non-Indian and Indian communities the same. And they've done that without consultation. And we strongly urge that not only a consultation occurs, but the Indian Health Service maintain its focus to Indian communities. And with that, I'll reserve any time. Thanks.
Well, I want to thank you both for your testimony, and Ms. Tuber, you put your finger on what to be a big problem for this committee, and that's just sustaining the progress that we had last year. As my good friend knows, I mean, that was the product of a budget compromise on all sides. Everybody gave something, and you have to give Chairman Calvert a lot of credit for taking a good slice of what was directed his way and putting it in these really critical programs, and particularly in terms of infrastructure and trying to catch up ground where we could. I would just urge you to keep advocating. There's not going to be much room next year, FY19, for much in the way of increases, and I'm actually more concerned about the 2 years beyond that, when we technically back under the Budget Control Act, and you could actually theoretically have a sequester again. So, just urging people to work together so that we can build on the progress this committee in a bipartisan way is made, and certainly under Chairman Calvert's leadership and his very faithful and able partner, Ms. McCollum, the ranking member. We've made good ground, but I think it's a little bit at risk. And this emphasis, again, on both infrastructure and substance abuse, thank you very much for bringing that to our attention as well. It's timely. With that, let me yield to my friend from Minnesota.
Thank you. I'm just going to kind of restate something that's in both of your testimony on the record, because I think this was very powerful, what you talked about with water and sanitation. We did, and so from your testimony, sir, babies in communities without adequate sanitation are 11 times more likely to be hospitalized for respiratory infections, 5 times more likely to be hospitalized for skin infections. In villages with very limited water service, 1 in 3 infants requires hospitalizations for lower respiratory tract infections. So the money that's spent up front is money that's deservedly spent to provide a good quality of life, but it also will be money saved, as well as saving people from going through misery and suffering, whether it's the infant or their parents. You both talked about, facilities and infrastructure. But, Ms. Diffel, you, in your closing, talks about increasing temperatures, changing Alaska, the permafrost eroding coastal river and shoreline communities, and we heard from some of the communities in the northwestern part of the lower 58 talk about their impact on climate change. You have in here that the Federal Government Accountability Office has identified 31 threatened Native communities, 12 which are looking to relocate their villages. When you're looking at doing some of these improvements, whether it's healthcare, infrastructure, water, sewer, how are the tribal communities taking in account what they see coming down the road impacting them on climate change with relocation? That has to be a very serious discussion that's taking place, because a lot of infrastructure dollars going into repairing something, knowing that the next generation that's being born today will have to move because of climate change. How are your Native Alaskan communities talking about that, so that we make smart investments as we make these investments?
If I may, on behalf of our region, because we have several communities that are threatened by an eroding, coastline. And
Sea level rise is safe with everyone.
yeah, no, I'm not going to say I'm ignorant, but it's happening in the Bering Strait. And what we've done, several of our communities have prioritized evacuation roads, because we need to build a road that eventually people can relocate and build homes on their own. And so they've opened up, the Native corporations have opened up land for development so people can start relocating themselves. One huge effort that we've undertaken is with our housing authority, our tribal transportation program, and our sewer and water via the health corporation is starting to coordinate that investment of roads, sewer and water, and housing. And we know several of our communities are facing the possibility of relocation, but starting to coordinate all of that federal investment and being aware of what's happening. Our leaders are having those conversations, and that's what I'm really excited about is our leadership. You know, they know how to respond and plan, and they know what they need to do. We just, as regional service providers, provide them the right support. And so we've taken this dialogue to our leadership because ultimately, you know, they're going to have to make the decision. Thanks.
Thank you.
Thank you, if I may. Thank you for the question. So the organization that I work with represents 229 tribes across the state, and we are confronted with the challenges, the engineering and logistical challenges of addressing climate change and the infrastructure needs of all of our communities, including those that my fellow witness is describing. We have found that the greatest success is the success that's born and conceived locally, and so when a relocation is to occur, the tribes or the members of the community are consulted in how they can best address their relocation. And so our organization has been recently identified with the responsibility of developing the relocation plan for Mektivik in Northwest Alaska. We find that the more opportunity that there is for the local reprogramming of federal funds or designation of federal funds as they're allocated allows for a more successful and a more efficient process. Thank you.
Thank you.
Thank both of you. We appreciate your testimony. If we could, we'll have the next panel come up now. If we can get your name tag. Thank you. Well, now as we get the part, since we're outside of Oklahoma territory, I start, mangling tribal names pretty badly. So I will apologize ahead of time. But if we can, we'll start with President John Buller. Is it the Yatkatat? Okay, Yatkatat. Tlingit tribe. So, Chief Buller, you're recognized, or President Buller, you're recognized.
Anyat kasani, asquani yachausati, achtawasigu, gunalchish yach sakai, gunalchish acheti sachi, Tlingit to adikach, wushye jagach tune, Juan, anakwe ish, yuchatu asak, gathach kagwantane achat. So I'd like to start by addressing you as the precious children of the land. We have a philosophy in Tlingit. When you look at that picture behind you, we see ourselves like those trees. And over there you have trees standing by themselves, and over there you have trees standing together. And we see us as humans being the strongest when we're like those trees standing together and our roots are intertwined when we work together. We can weather any storm that comes at the top of that mountain. So I thank you for hearing my words today, hearing our concerns coming from our village of Yakutat. I'm representing the Yakutat Tlingit tribe as the tribal president. I'm representing the 7 clans that live there in Yakutat. We have a small community of about 600 people. And we're located in the Wrangell-St. Elias mountain range between Mount St. Elias and Mount Fairweather on the coast. We're 220 miles away from a city in either direction. We have Cordova to the north and Juneau to the south. And we have twice-a-day jet service, or you can get in by boat. Our geographic isolation makes it absolutely critical for us to be able to provide high-quality health care and health services in Yakutat, as we're the only healthcare provider there. We operate in the city and borough of Yakutat, and the city has a volunteer emergency medical service squad. Our community clinic serves the entire community. We see us all as a family, and we'd like to make sure everyone is taken care of. And I'd like to just thank you, Chairman Cole, Ranking Member McCollum. Our main focus today, directed by the tribal leadership and the tribal members, is continuing to improve the tribal health care and the quality and access. Pleased to announce that we're one of the 7 tribes elected for the IHS joint venture. And so we're moving forward with our project. IHS approved us for 11,000 square foot facility, and on here it's written as 11,000, but we could see that to serve the entire community, we're going to outgrow our facility immediately. So we've aimed at upping it to 18,500 square feet. And the facility will allow us to provide improved and increased health service delivery and adequate space for visiting specialty providers as well as our own staff. And so we'd request that you continue to support the joint venture program. It's very important for us to also have that IHS staffing package and funding available in a timely manner, because we're putting so much money forward to get this construction to happen, and we have to fill the building. We have 20.5 FTEs, so we'll be able to bring in 20.5 employees, and we have to get them acclimated to Yakutat. So it's important for us to get the word out there as soon as possible so that we can staff our facility. And I'm not sure how it's looking for FY2019, but we're hoping that if things are tight, there might be a way to maybe do some kind of bridge funding. I know it's been done in the past. In Yakutat, as our written testimony shows, there's a disparity in the IHS funding that our tribe receives. Our per capita IHS base funding is only $700 per active user. And even combined with services provided through our regional hospital, the amount comes to only $1,500 per capita. And when you compare that to the nation at $9,200 or the IHS average at $3,300 per active user, we're feeling it. You can see people aren't making it to get out for physical therapy when they have injuries, or they're just trying to get on a list, and it's going to take 6 months, it's going to take a year, and they're missing out on those seasons of work, seasons of gathering, as it debilitates them. And so for this reason, this is why we support fully funding the IHS at the recommended national tribal budget formulation. Short of that, we support funding the Indian Healthcare Improvement Fund to help reduce the IHS funding disparities in Indian country. And we're thankful for that funding coming back around. Along with that, we support the increased funding of the IHS Purchase Referred Care Program. Being so isolated, we average 24 tribal medevacs a year, and that's not including our tribal memberships. It could be up to 50 or more, and it's a pretty high rate of around 30,000 a medevac. I'm sure that you've been hearing a lot about telecommunications connectivity with the Universal Service Administrative Company imposing the pro rata reduction in rural health care due to the funding cap. And for many years, we've received this subsidy. It pays for our internet so we can connect the satellites, so we can do our telehealth, telemed, we can talk to our doctors. This connectivity is our lifeline, and without this subsidy, we're looking at paying $20,000 a month, and this could be easily a third of our operating budget. And this is another disparity. It's taking away from that healthcare delivery that we should be providing. And the shortfall this year in Alaska for tribal health programs was $18 million, and it's expected to double by next year. And we know this is a Federal Communications Commission issue, but we're asking that the subcommittee support in lifting the cap and fully restoring the USAC subsidies. We're joining others in opposing the IHS proposal to amend the 105L of the Indian Self-Determination Act so that they would not be required to fully fund facility leases. We do thank you for the funding that has been provided for these clinic leases in the past several years and would ask that it be increased. And with regards to contract support costs, thank you for providing full funding. And we ask that you disregard the administration's proposals that could deny carryover authority for the CSC. On another CSC matter, we hope IHS will relent and begin paying CSC on its grant programs. Finally, of course, we support the special diabetes program for Indians. It's kind of a, I've heard the word epidemic in Indian country, and it shows there's a high rate of diabetes even in our community. And we ask that the funding continue to be made mandatory rather than discretionary. I thank you and be glad to respond to any questions.
Thank you for your testimony. If we can next, we'll go to Bruce Thomas, the Natural Resources Director for the Council of the, is this Athabaskan?
Athabaskans.
Okay, well, that's close as unlikely to
Close
get.
enough. Good afternoon, Chairman Cole and Ranking Member McCollum and members of the subcommittee. I'm Bruce Thomas, the Natural Resource Director for the Council of Athabaskan Tribal Governments. Thank you for holding this hearing. I am pleased to be here. The Council is a consortium of 10 tribal governments located along the Yukon River and its tributaries in northeastern Alaska. Our organization provides a variety of services to the tribal citizens of our region, including a Natural Resources Department, Education Department, and full health care services at the Yukon Flats Health Center and village-based clinics in 4 of our villages. I'd like to highlight several recommendations in my testimony. First, expanding self-governance. We are one of the first tribal consortiums in the nation to develop non-BIA self-governance annual funding agreements within the Department of Interior to carry out certain programs, functions, services, and activities. Since 2004, we have had a self-governance agreement with the U.S. Fish and Wildlife Service, and since 2011, an agreement with the Bureau of Land Management / Alaska Fire Service. Excuse me. Through our Fish and Wildlife Service Agreement and the Yukon Flats National Wildlife Refuge, the Council has overseen cooperative moose management planning, education, and outreach programming, harvest data collection and reporting, logistical maintenance of the only logistical outpost in the refuge, and refuge information technician staffing. Through the BLM Alaska Fire Service Agreement, the Council is successfully providing emergency firefighter testing and training in the Upper Yukon Zone and logistical support to the remote BLM fire station in Fort Yukon, Alaska, as well as numerous other fire training programs. This has allowed the Upper Yukon Fire Management Zone to increase its fire preparedness and capacity for additional fire preparedness activities. We are concerned that the administrative costs funds for these agreements remain underfunded, which hinders our success and ability to grow. We are also concerned that the Department of Interior scopes of work are being limited and the original intent and practice of self-governance, which is to build tribal capacity to take on increasing levels of responsibility, is not being properly carried out. We request your support in fully funding the administrative cost funds for these agreements and to expand self-governance agreements beyond the Department of Interior. Secondly, continue to fully fund contract support costs for IHS and BIA. Additionally, we appreciate your leadership and commitment to fully funding contract support costs for IHS and BIA Indian self-determination agreements and ask that it continue. Place the IA's budget on an advance appropriation schedule. However, we again request your support in placing the IHS budget on an advance appropriations schedule as Congress has done for the Veterans Administration health accounts. Having advance notice of funding levels would greatly aid the Council in program planning, recruitment, and retention of health professionals. Manlick versus Burwell decision. We also request that this subcommittee does not accept the administration's proposed language to overrule the Manlick versus Burwell decision regarding leases under Section 105 of the Indian Self-Determination and Education Assistance Act, and decline to include the language in the FY2019 bill as you did in FY2018. Increased funding in BIA and IA's budgets for behavioral health programs. The Council's communities have extreme rates of suicide and substance abuse, which contribute to other problems such as crime, domestic violence, child abuse, and neglect. We support expanding programs like the Generations Indigenous and the Taiwahi Initiative to help our youth and communities overcome these problems. We also support the proposed FY2019 IA's budget containing $150 million in new money for tribes to address the opioid epidemic. Including behavioral health matters, we support direct funding to tribes rather than coming through the state. Last, support elimination of the arbitrary cap on internet subsidies for critical telecommunications connectivity. Lastly, although not under the subcommittee's direct jurisdiction, we request your support and engagement in addressing extremely high cost of internet in Alaska. Due to a funding cap, a pro-rata reduction in rural health care funding has been instated. We ask for your support in reinstating the Universal Service Administrative Company telecommunications subsidies to tribal health programs throughout Alaska. Thank you.
Thank you for your testimony. And next, if we may, we'll go to Mr. William C. Wilson, council member of the, is this Metlakatla? Metlakatla. Beautiful name. Indian community. So, gentleman's recognized for his testimony.
Good afternoon, Mr. Chairman and Ranking Member McCollum. Thank you for your time. I'll keep it brief. Of the submitted testimony, I'll be touching on the first 3 points as they're the most pertinent to the Metlakatla Indian community. I'm a ranking councilman of the community and have been for nearly 20 years now. I've given over half my life to the community, and I will probably give the rest to it. Number one, Metlakatla would like a new category within the BIA construction budget created for electrical transmission and telecommunications project construction, of which $7.6 million is needed to complete the intertie between Annette Island Reserve, Alaska, and neighboring Ketchikan, Alaska. In the written testimony, it was written as 11.5. We have done a rework to reduce costs. Item number two, we would like continued strong funding for the BIA Safety of Dams program within the BIA Resource Management construction budget, of which $1 million is needed to address the hazard mitigation needs and initial planning phases for improvement at Chester Lake Dam on Annette Islands Reserve. This is the primary source of our potable water and has the potential to be a disaster if something goes wrong with it. Third item, we wish to continue strong funding for tribal hatcheries under the Fish and Wildlife Parks sub-activity within the BIA Trust Natural Resource Management budget. On a note with that, I'd like to thank this subcommittee and the efforts of the committee. Our hatchery, due to large in part of the reoccurring funding that was granted to us, is now expanding every year. Our end goal in 2 years is to release another 100 million chum salmon into the region, increasing the regional economy by conservatively about $26 million. And that is a direct result of your considerations, and I'd like to thank you on behalf of my people.
Thank you very much for your testimony. Next, we'll move to Natasha Singh, the General Counsel. Is it Tanana?
Tanana Chiefs.
Tananachi. Wow, they don't have the full word here. Tananachi Chiefs Conference. Gentlelady's recognized.
Thank you. Good afternoon, Chairman Cole and Ranking Member McCollum. My name is Natasha Singh. I'm General Counsel of Tanana Chiefs Conference. I'm an Athabascan, and I'm a member of Stevens Village, and I also serve as a Stevens Village Tribal Court Judge. Tanana Chiefs Conference is a non-profit intertribal consortium of 37 federally recognized tribes in 41 communities across interior Alaska. Our service area also includes the tribes of the Council of Athabascan Tribal Governments that Bruce Thomas is representing today. I am honored to testify before you on behalf of TCC concerning the President's FY19 budget for BIA and IHS. First, I want to commend the subcommittee for its bipartisan support of Alaska Natives as evidenced by the passage of the March FY18 omnibus measure that added hundreds of millions in additional appropriations to the BIA and IHS budgets for FY18. The message from TCC is to continue the good work for FY19. Broadly, TCC encourages the subcommittee to continue in the FY19 appropriation the expansion of health services made possible under the Indian Health Service budget. For both health services and IHS facility construction needs, expand public safety across interior Alaska and Alaska with continued and targeted appropriations, increases for law enforcement and tribal court programs in PLA 280 states like Alaska, where state law enforcement programs and services are simply not available. And finally, increase funding for FY19 for job training and economic development opportunities for Alaska Natives and American Indians who face tremendous challenges to secure post-secondary education, job training, and job opportunities to provide for themselves and their families. So the TCC service area, just to give some perspective, is quite large. It would include the whole state of Minnesota, Wisconsin, and the Dakotas all combined. That's what TCC is in charge of, and it's bigger than Oklahoma as well.
Well, not by much. You sound like a Texan.
But you can imagine, so this is along 4 rivers, a couple mountain ranges, the challenges of providing services, both health and human services across our area is quite difficult. And on the one hand, we are making great progress because of the programs you have supported. Just recently in Bruce's hometown of Fort Yukon, just yesterday, we were able to honor 2 PhDs. Gwich'in women received their PhDs, and it's just amazing that our communities are becoming safer, they're becoming healthier, and we are reversing the health disparities. On the other hand, we still struggle. You heard all the testimony today regarding the disparities. We need to be able to have proper funding to increase the programs. First, IHS appropriations should continue to increase. IHS appropriations remain about 1/4 of Medicare spending and about 1/3 of national per capita spending levels for health. What that means is health care cost per person is here, and IHS funds it at here. And that's what I like to educate our constituents about in Alaska. When they're complaining about services, I'm like, this is what we're dealing with in terms of funding levels. I don't know why, we have this huge funding disparity, but we have it. Medicaid is one way tribes are able to make up for that huge shortfall. And if we were to lose Medicaid and other third-party reimbursements, the IHS appropriation this subcommittee would need to allocate would have to at least triple, or organizations like the ones we represent here on this panel would have to cut back our health care programs, which we can't afford to do. TCC remains one of the only health care entities in Alaska that does not have a regional hospital, so we really rely on our village clinics and purchase and referred care. Finally, I'd just like to hit on promoting programs that help keep Alaska Native families together to combat substance abuses and preventable death. I'd like just to support what I heard the testimony from Norton Sound, Megan Avonal Simple. She hit it right on the head with that substance abuse is impacting our families. This fall, I sat with 3 mothers, all from the same extended family, who had lost adult children due to substance abuse, either suicide or trauma. And just sitting there with them as they mourn for their adult children, that's the impacts. It was like a black hole. It just pulls from our communities. And while these adult mothers, they can deal with what they need to deal with, I'd like you to remember that the first responders to all all these traumatic, tragic incidents resulting from substance abuse are our children. They're the ones who are being exposed to this, and we would like to keep our children innocent. We ask you to support those programs, including the PL 280 Tribal Court funding, like I mentioned before. But I'd just like to reiterate that TCC does support the joint venture projects that Yakutat mentioned, the non-BIA funding that CATG mentioned, and the 105L lease language that was mentioned today from all the other entities. So thank you very much.
Thank all of you for your testimony. Let me just make a couple quick comments and then go to my friend. Yeah, I always love these hearing days because you get so much, you see the diversity of Indian country all across the United States, and yet at the same time, there's a lot of commonality in terms of the defense of tribal sovereignty, the importance of self-governance, the insistence that the federal government fulfill its trust responsibilities, and the genuine need for everything from infrastructure to health care to sorts of things that, frankly, we have an important federal role. I think this committee for really several years, as the chairman said in this morning's testimony, under chairman of both parties, has really tried to address these things. We do always have a problem in that the jurisdiction of the committee is really vast and its resources are somewhat limited. We've often debated whether or not we ought to move health care, for instance, just literally to another committee simply because it has more money and, could probably address these needs easier. You raised the question, Ms. Singh, about the healthcare disparities, and I think a lot of it is, again, we don't have, other than through third-party reimbursements, much in the way of mandatory money directed into our healthcare system because it's really older. Most of the mandatory programs were created in the 60s. Indian Health Service has been around a long time before we did that. And I think this is almost an accident. We had sort of one healthcare system grow up because we had a trust obligation, and then all of a sudden we developed another one, and we didn't appropriately, in my view, include Native Americans in that process. And that's something we struggle with here a lot because, while I think this committee would probably like to move it to mandatory, I think other committees, including the Budget Committee, usually are less attracted to that possibility. But it leaves us with this very real disparity in funding levels, which really shouldn't exist. I mean, we should be spending roughly the same amount of federal dollars for every American. So again, we'll continue to work on that. Let me just, in the last comment, I wanted to pick up on something Mr. Thomas said because I think it's absolutely key, and which is self-governance, expanding the capacity for that. I've seen the difference it's made in my own tribe in my lifetime. The more functions we've taken over for ourselves, the better off we've done. Governor Anatobi, who's the leader of our people, I remember once telling me, and we took over our healthcare system, and like many of you, we've used the joint venture program. It's been extremely important to us, and we've been fortunate because to use that, you've got to have money, and not every tribe is in that position, but it does let you catch up in a hurry if you can do it. But I remember I visited another tribe that did not want to manage their health care, and that sort of was puzzling to me, so I just mentioned it to Governor Anatobi, and his first job had been building our healthcare system, and he said, Tom, really when we started doing this in the 1970s, our own people, honestly, they would never have said it out loud, but wondered whether or not we could do it. And then they noticed as soon as we started, the wait times really started falling down. Because you couldn't get to anybody in the IHS, but you could sure call a tribal counselor in a hurry. And all of a sudden, things started responding, and people began to understand that the more of these functions we took over, and that doesn't mean letting the federal government off the hook. I mean, they have a trust obligation here, we have a financial obligation, but the more of these positions in our respective communities that are held by our respective people, I just think the better off you do. And it's the real key to going forward. We're always going to be pushing the federal government to go. We had an interesting to do more because it doesn't do what it's committed to do. And we had some interesting testimony today that suggested it did 10 or 20% of what it really is obligated to do. And so you have to always keep that fight on. But at the same time, if you wait around for the federal government, you'll be waiting forever. So you have simultaneously have to develop that self-governance capacity. And I think wherever we've done it, it's amazing how well our people have done as they've assumed these kind of roles. But again, I want to thank all of you for traveling so far and for your testimony. It's very compelling and very helpful to the committee. And certainly, the chairman makes the final decisions around here in consultation with the ranking member about the budget. But I suspect the proposal out of this subcommittee will be somewhat different than the administration's proposal. I don't think we are anxious to lose the gains that we've been fortunate enough to make in the last couple of years through bipartisan cooperation. So, again, you'll see Democrats and Republicans alike working hand in hand on those issues out on this subcommittee for sure. With that, I yield to my friend from Minnesota.
As Mr. Cole pointed out, boy, you just learn something new all the time. So all four of you, in one way or the other, some of you more directly, some of you spot on, talked about telecommunications. And, the more remote you are, the more important it becomes. So I didn't know anything about the USAC Rural Area Service until today. And I have found out a lot about it. It's described as a victim of its own success because as more and more tribal communities have connectivity, more rural areas have connectivity, there's more users, there's more, the cost of the system goes up because there's more folks on it. And then as we provide better and more technical equipment, for example, the reading of radiology scans, as they get better, they take up more space. Anyways, I learned a lot, but I learned that we need to, and I also did some research. We have one member of this committee who serves on financial services where this is housed because we don't directly fund it, but it's going to affect everything that's success in Indian health that we're trying to accomplish here as a goal. So Mr. Stewart's going to become very popular with some of us very quickly because he's not only on this committee, but he's on financial services. And so we need to make sure that that allocation is bumped up to help you and other rural communities. So you gave me something to do this afternoon, and for that, I thank you, and for taking me on a learning journey on how to work not in a silo, but in a more of a broader community setting to address some of the challenges that you have being in such remote rural areas. And as you pointed out, I can drive to Red Lake. It might take me 4 hours, but I can get to Red Lake, and Red Lake's going to be fairly connected to the rest of Minnesota and to the lower 48. You go to where you're located, and that's not the same thing. And so thank you for reminding us of our responsibility not to just be in our comfort zones for what we think we can deliver, but for taking us out of our comfort zones to work with you on what we should be delivering. Thank you.
Wasn't here during your testimony. I'll say Don Young, some constituents were out from Alaska, so we see Don every vote.
We do.
He's hard to miss. He's all of Alaska, that's for sure. But thank you very much. Look forward to looking at your minutes. Appreciate it. Have a good day. Okay, I think we have our next panel coming up. Hi, how are you? Good. Good. Everybody's got their name tags? Okay, great. Perfect. Well, thank you. You're probably all aware of the 5-minute rule. Each of you have 5 minutes for testimony. Once the yellow light goes on, you have a minute to close up. We certainly appreciate your coming out here today. Looks like you're come from long distances, so we certainly appreciate that. With that, Patty Brown Schwellenberg, Executive Director of the Shirkosh Regional Resources Commission from Alaska. So you're recognized for 5 minutes.
Thank you, Chairman Calvert, and good afternoon, Ranking Member McCollum and other members of the subcommittee whose staff may be here. Again, my name is Patty Schwallenberg. I am a proud member of the Lac du Flambeau Band of Lake Superior Chippewa Indians and happy to be on a panel with my fellow brothers and sisters from the Midwest. I'm the Executive Director of the Chugach Regional Resources Commission, which is an intertribal fish and wildlife commission of 7 tribes located in Prince William Sound and Lower Cook Inlet, which is south central Alaska. We have an annual appropriation of $410,000 from the BIA within the Tribal Management Development Program and Trust and Natural Resources, and it is small in comparison to the number of villages and the vast area that we cover, but we have learned with dwindling budgets that leveraging these funds is very important. So we average our funds at nearly a 5-to-1 and operate on a $2 million annual budget with full-time and seasonal staff of about 20 people in the villages and in our base in Anchorage. As an example, Chugach Alaska Corporation just developed a $5 million regional community economic development fund and for the Chugach region tribes and tribal organizations. So we've partnered with them, and we're going to be one of their first recipients of this fund to develop kelp farms in 3 of the communities. Those will employ about 5 employees each, and we have a processing facility in Titlik, and that will employ 15 people. So that's a pretty big project that Chugach Alaska is very excited and partnering with us on, and we're seeking other funding to get that project going, but we're looking at 2019 to have that putting that in place. Our shellfish hatchery, which we're very proud of, the Alutiiq Pride Shellfish Hatchery, is set to produce the kelp and assist the communities in getting the farms started. So for these types of things, we oppose the administration's proposal to cut our federal funding by $30,000, and we actually would ask that the subcommittee to consider increasing our funding by $100,000 for FY19. As I said, with our ability to leverage our funding, this has the potential to generate an additional $500,000 for our program and ensure the viability and growth of the communities that we work for. So some of the entities, the Forest Service, Fish and Wildlife Service, some private foundations, the North Pacific Research Board, NOAA Fisheries, we've really expanded our search for partners because of the funding world at this point. We also manage the Alaska Migratory Bird Co-Management Council and participate on the Indigenous Peoples Council on Marine Mammals. So we do harvest surveys for both marine mammals and migratory birds, and we manage the regulation of the subsistence harvest of migratory birds during the spring and summer. So and our hatchery is continuing to do well. We're producing several shellfish species, both for the shellfish industry and for the communities. We're continuing to conduct the research on blue king crab and red king crab in hopes of enhancing the populations that are doing very well near Kodiak and in the Gulf of Alaska. And we're also, we have an ocean health lab that is testing the water quality across the state. Actually, it started in the Chugach region, but other areas like the North Slope and Western Alaska have been contracting with us to test their waters for the alkalinity in the ocean, and because it does affect the shellfish and the other species that are harvested by our people. So with the 5-to-1 ratio that I mentioned, I really think that we have been good stewards of the money that you have provided over the 25, 26 years that we've been working with the BIA and Congress, and we really appreciate it. I feel like we take our jobs very seriously, and we provide, our main focus is to provide the jobs and revenue at the local level. And by monitoring and protecting our waters, we ensure the continuity of Alaska Native hunting and fishing practices. I hope you agree that all the programs funded, not just in Alaska or for the Chugach Regional Resources, but for all the entities that have testified before you this week, that the BIA's Tribal Management and Development Program are worthy of the financial support. Obviously, we all need more money to do the things that we do, and I hope that you'll reject the administration's proposed cuts that actually help us expand our natural resource services and programs for FY19 and future years. Personally, I think our appropriation is a rounding error in Washington DC, but I assure you it means the world to us in Prince William Sound and Lower Cook Inlet. So thank you for the opportunity to testify.
Thank you. Appreciate your testimony. Next is Sandra Lewis, the Tribal Council Recorder for the Little River Band of Ottawa Indians in
Sandra Lewis, the Tribal Council Recorder, Little River Band of Ottawa Indians, Manistee, Michigan. I am honored to present this testimony on behalf of my nation regarding our views and priorities for the fiscal year 2019 President's Annual Budget Request. I would like to begin by thanking the committee for the continued respect of our native sovereign nations and prioritizing funding for Indian country in 2018. Well, it seems that there is never enough to meet the needs of our people. We recognize your efforts to honor the treaty obligations. We are grateful the proposed cuts to programs in both the Bureau of Indian Affairs and Indian Health Services did not take place in 2018. We ask for similar consideration related to the President's 2019 budget. We call on Congress to reject the proposed budgets. I am certain I echo the testimony of several other nations when I commend the proposed increase to the Indian Health Services. Further, we request the 2019 budget address the important issues of contract support costs. Furthermore, while we applaud the increase in funding to address the opioid crisis, it is important to recognize the funding is largely targeting the problem when it has already manifested in destroyed members of our community. Focusing on our funding and healthcare and substance abuse programs ignores the root cause of the problem. And I see that, to not just blanket the issue, but we need a solution. And that solution, I really think is giving hopes, dreams, goals, and giving people futures to look forward to. A long-term solution for the substance abuse issues that plague many communities like ours is a commitment to programs that create opportunity and an alternate path. The President's budget proposed to eliminate programs for housing improvements and education, including job placements and training programs. The proposal also includes several reductions to social services, right protections, roads transportation programs, and infrastructure grants. We focus on historical preservation for our culture and language because we believe it has a lot to teach our citizens and the United States. We include traditional medicines and our healing practices. We encourage federal programs specifically addressing substance abuse to allow for the freedom to embrace cultural relevant teachings. Recognizing spiritual practices and native language builds pride in our community and affirms who we are as an Anishinaabe nation. In managing our IHS funds, we look to the whole person. We look at them physically, emotionally, and spiritually. We recognize the cycle of sicknesses and dependence in the last years. We have been able to offer services including telepsychiatry and pharmacy. The second way we promote our homeland is through our natural resources, management, and preservation. The tribes work with the state of Michigan, tribes and other organizations to protect our waters and promote the return of native fish and wild rice. The connection of our people to the water is a spiritual connection. As people, we rely on water to sustain our life. Water does not discriminate. It does not make distinction over race, religion, or politics. Our belief is that it is a living spirit supporting us and shall be honored and respected by all the Anishinaabe. We agree that the President's request to include an increase for the Clean Water State Revolving Fund, but the proposed cuts to the Great Lakes Restoration Fund should be rejected. All Michigan tribes take stewardship of the Great Lakes very seriously. It is one of the United States' great resources. The health and the future of the Great Lakes has never been more important to us. We are blessed to be able to protect it, and we are asking Congress for the assistance to continue in this effort. And I just want to say that, we did reach out and we did start a program up and it's the New Generation Learning Center. And we, you know, aside from federal grants, we reached out to Kellogg Foundation, and we reached out to the other grant sources, and we did start, it's not just a daycare, but it's an education system, like an early head start for children. And with that, I just would like to say that Little River appreciates the opportunity to present this testimony to the committee on these important matters. Thank you.
Thank you. Thank you for your testimony. Next is Brian Newland, Board Director, or Board Member of the Chippewa-Ottawa Resource Authority. Recognized for 5 minutes.
Thank you, Mr. Chairman. First, let me say, Ani, Nibina Mikanem Bamose Indigenous, Mangandodem, Gnoshikaning, Donjaba, Nishnabe, and Dao. My name is Walks Many Paths, but you can call me Brian. I am the member of the Wolf Clan and also chairman of the Bay Mills Indian community. And, you know, with, I guess, all due respect to the my friends from Alaska who came today, you know, the running joke in our part is that we're not at the end of the world, but you can see it from where we are. We're right on the Canadian border in the southern shore of Lake Superior. So, Mr. Chairman and Ranking Member, I'm here to talk about 1.5 things. Fish and the Great Lakes. Fish are so important to our people, the Anishinaabe people, that they shape our culture, they're parts of our ceremonies, and they were our ancestors found them to be so important that we reserved the right to fish in a treaty with the United States. We signed a treaty, our member tribes here signed a treaty with the United States in 1836 that ceded what is now 40% of the state of Michigan. And that land cession allowed the state of Michigan to enter the Union as the 26th state in 1837. And as a condition of allowing the great state of Michigan to come into existence, our people reserved the right to fish. And we have exercised that right ever since. And it is a right that our people take so seriously and value so much that they've risked their personal safety and their freedom to exercise that right. My grandparents, before I was born, and before commercial fishing under our treaty was recognized as a legal right by the state of Michigan, used to go out onto Lake Superior in the middle of the night to set their nets and then to haul fish out. Now, Mr. Chairman and Ranking Member, I don't know if you've ever been in Lake Superior, but even on the hottest day, it's pretty darn cold. You know, my grandmother has a colorful description of how that process worked. It's probably not suitable for the congressional record, but suffice it to say she found, her and my grandfather found the process of catching fish in the middle of the night rather uncomfortable. And my father-in-law used to tell stories about the same thing, catching fish at night. And I recall one story he shared with me where he had to hide in the water in the dark because as they were coming to shore, they saw a group of sport fishermen with guns and baseball bats waiting for them to teach them Indians a lesson about fishing. So he had to wait in the frigid waters of Lake Michigan until they left the boat launch. And then in the early 1970s, a gentleman who lived just down the street from where I grew up, Albert LeBlanc, was cited by the state of Michigan for fishing illegally. And his case went all the way to the Michigan Supreme Court, which recognized that we, in fact, do have a treaty right to catch fish. And to enforce that right, the United States brought a lawsuit on our behalf against the state of Michigan. And that case is called U.S. v. Michigan, and it's been open and active in the federal courts for 45 years, which is longer than I've been alive. Our tribes, in cooperation with the state of Michigan and federal agencies, manage the Great Lakes fishery under a consent judgment in that case. And that work is funded through the Rights Protection Implementation line item in the budget. You know, I served at the Department of the Interior in the last administration and helped formulate this part of the budget for the president's budget requests. And you know, it's fair to say that we found it to be an important line item, and Congress, thankfully, and I think in your good wisdom, agreed. But in the most recent presidential budget requests, they've proposed a 1/3 cut to this line item, rights protection implementation. That 1/3 cut, if implemented, would impair the ability of tribes in Washington State, Oregon, Minnesota, Wisconsin, and Michigan to regulate treaty fishing under federal court judgments. And if we're not able to regulate those activities, the treaty rights themselves will be at risk. So we're before you asking today, Mr. Chairman and Ranking Member, that Congress maintain level funding for this line item and allow us to do the work that we've been doing for the past 40 years, hand in hand with the federal government. And also to keep fighting for the Great Lakes Restoration Initiative. That's a good program as well. So miigwech, thank you.
Great, thank you very much. Aaron Payment, chairperson of the Salt Sweet Marie Tribe of the Chippewa Indians. Have I got part of that right?
It's close. Sault Ste. Marie.
Okay.
Ali, bonjour.
Okay.
My name is Aaron Payman. I'm the chairperson of the Sault Ste. Marie Tribe, also the first vice president for the National Congress of American Indians. Good afternoon, Chairman Calvert and Ranking Member McCullough. I'm reminded that the last time that I testified here was actually the day before Billy Frank died. He testified the day before he died. So the last time I was here, I got the honor of testifying with Billy Frank. So thank you for inviting us to give our input on the FY 2019 budget, which will either uphold the U.S. government's treaty and trust responsibility or abrogate this responsibility under what feels like a new Indian termination era. I'm here today to sound the alarm to a policy shift which sees tribes as racial groups rather than as sovereign nations. I'm hopeful that you will safeguard our funding in the fulfillment of providing health, education, and social welfare for as long as the rivers flow, grass grows, and winds blow. I'm mindful that while the President proposes, Congress disposes. Some of the proposed eliminations include Indian Community Development Block Grant, Low-Income Home Energy Assistance, or LIHEAP, Indian and Native American programs in the Department of Labor, Native American Community Development Financial Institutions, Tribal Energy Loan Guarantee Programs, and eliminations within the BIA, including small and needy tribes, Housing Improvement Program, Tribal Climate Resilience, Alaska Native Programs, JOM, scholarships, and adult education. That's the list of the programs that will be eliminated. Here's a chart to show you on the bottom part of the President's proposed eliminations. So the major reductions for our Native American Housing Block Grant cut by 8.2%, Bureau of Indian Affairs cut by 15.6%, and major reductions within the BIA include social services cut by 37%, Indian child welfare cut by 27%, tribal welfare assistance cut by 11%, rights protection implementation cut by 37%, and job placement and training cuts by 35%. I also want to sound the alarm of the administration's faulty view of tribes as racial groups rather than as governments. This is a current issue we're facing with CMS. Tribal governance existed long before intervention. Tribes continue to govern their citizens as recognized by the U.S. Constitution in several sections, including Article 1, Section 8, Paragraph 3, which memorializes tribes as sovereigns equal to or exceeding that of state sovereignty. Hundreds of treaties, federal statutes, and Supreme Court precedents, including Morton-Moncari, 1972, and Rice-Catano, 2000, reaffirm tribes as sovereign nations rather than as racial ethnic populations. As a subset of the U.S. populations, we do have the unfortunate distinction of having the worst of the worst statistics on a number of indicators like suicides, alcoholism, low graduation, unemployment, incarcerations, and violence against our people. These outcomes are attributable to the legacy of the federal Indian policy and resulting historical trauma and tribal critical race theory through a cyclical lack of opportunity which perpetuates the worst of the worst statistics. However, the funding that exists for health, education, and social welfare is based on treaty and trust responsibility and not based on race, reparations, or even welfare. Rather, we prepaid with the blood, sweat, and tears of the millions of acres of land of our ancestors. With this new federalism, I see the abrogation of treaty and trust responsibility in the President's proposed budget as it ignores the identified needs through the BIA budget formulation. I also brought copies for you of that same chart and a legal analysis synthesized between NCAI and my tribe of tribes as sovereigns and not as race. The proposed overall level of the BIA and BIE would take funding in nominal dollars back to FY 2013 sequestration levels, and adjusted for inflation, proposed funding is lower than any enacted level going back to 2003 and 21% lower than the level in 2010. Finally, as a member of CORA, I'd like to also support our treaty rights implementation funds. We're looking for the full $39.4 million in rights protection implementation dollars in 2019, and maintaining CORA's share of that at nearly $6 million, and then appropriate $1.9 million from the Bureau of Indian Affairs for litigation support, and an additional $450,000 for FY 2019 to negotiate our new consent decree. The state's already appropriated the money in preparation for a battle, and we need to have the same consideration to be prepared. As our trustee, we hope that you will give serious attention to this issue and uphold our treaty and trust responsibility. And thank you.
I appreciate your testimony. Thank you very much. And one thing I think I can say with a pretty good assurity that we'll be taking care of the Great Lakes.
Thank you.
The ranking member is very insistent that we do so. And plus, we have another gentleman from Ohio, another gentlelady from Ohio that also represent Lake Erie. So we have great representation on this committee with the Great Lakes. And also, I could say with some assurity that though the president, any president, sends over their recommendations, we look at them respectfully, and then we do what we're going to do. So we'll be working together to make sure that we keep our obligations to Indian country, and we'll be doing that soon. So kelp farming, I just saw a special on that the other day. It seems like that's a big business. It's people are eating kelp.
The wave of the future we
Wave
see,
of the
and
future.
people have been coming to us to ask if we're going to do kelp. Can you raise kelp? And so we just tried, and we have a great staff there, and yeah.
I guess they do it what they call layer farming. You put the shellfish on the bottom and the kelp above, and so
It's a very short growing season. There's not much to do until they're ready to be harvested.
yeah,
so.
it's good for the waters and everything else. So it's great. I appreciate that, and it's great that you all gave Minnesota the land that they have. That we wouldn't have Betty here today. I appreciate that. 1836. That was a long time ago. And I appreciate all of you coming here today. We appreciate your testimony, and we hear you on our government trying to do this racial situation. I'm not quite sure why they did that, but we'll be addressing that also. Ms. McCullum?
Thank you. One of the reasons why sometimes with the northern tribal, especially the Mast area, people look at the tribal names and they don't think French. And so we were part of the Louisiana Purchase, and so a lot of French is interwoven and intertwined in a lot of the language that you hear from the first people of the Great Lakes. I wanted to just take a second and ask. I've been concerned, and I think reorganization is always needed. You reorganize your house, your kitchen. You reorganize, your garage. You reorganize your workplace. You reorganize sometimes your local units of government. The way your tribe is organized. You look at it so that it becomes more efficient and more effective going out into the future. And Secretary Zinke's been talking about reorganizing the Department of Interior, and I don't object to looking at a reorganization. but we have heard from many of the tribal nations here that there's been no consultation. And in fact, can you believe it? There was one map that didn't include Minnesota in the Great Lakes region. Not going to happen. We'd have to redo every history and geography book. So could I just ask you one-on-one if to go down so that we can hear from the other panel before we go to break to vote? And thank you for your full testimony. Has there been consultation either with your tribe or with the tribal organization that you're part of? We heard from the chairman of NCAI, not so, but I haven't heard from anyone from MAST yet. So,
actually, we contacted some of the federal interior agencies and asked, what's going on, how is this going to affect our communities, and they didn't seem to really know. So we didn't get very far with that, request to get some information on it. So.
Attend mass this year, and I didn't get that information, so.
But your tribe, to your knowledge, hasn't had a call saying, what do you think of our blueprint or our plan for reorganization? Thank you.
Thank you, Ranking Member. Not only has there been no consultation, there's actually been worse than that, which is sham consultation. Several weeks ago, I got a phone call from our local BIA office in mid-morning asking, Mr. Chairman, what do you think about the Department of the Interior's plan to reorganize? And I said, I haven't heard anything. And he said, well, I have to submit comments by the end of today on what the tribes here in our agency think about Department of the Interior reorganization. And so my answer was, well, until we see anything, we're against it because we have no idea how this will shake out. And I have to add that in the last administration, when I was at the Department of the Interior, we consulted endlessly on reorganization that didn't occur. But in this instance, Ranking Member, it's been sham consultation to the extent there's been any at all.
So I would just add, so again, I serve as the first vice for NCAI and also the vice president of MAST. And shortly after the election, we had a session with the executive team and Jim Kaysen, who I would describe as the shadow administration. I'm not really sure what his role is within the administration, but it seems to be all-encompassing and advisory on Indian issues going forward. Today, actually, at 4 o'clock, they're having a hearing on the Assistant Secretary on Tara Sweeney, who I support for appointment. But a main point with that is that there aren't Indians in key positions that these issues are being bounced off of. There's a lot of, and no offense to anybody in the room, but there's a lot of white men setting directions for Indian people without taking consultation from Indian tribes. And so I would say that they should put the brakes on this until tribes can come up and formulate what this would look like. We're the only people within the Interior Department that they're responsible for. So we would ask that they treat us a little bit better than the wildlife, it's a beautiful picture there, and the animals that they have responsibility for, but the people that are on the receiving end, and ask their implementation or how it would affect them. So thank you.
Mr. Chair, I want us to take a look at the fund that the tribes use to protect their hunting and fishing rights. Being a person in junior high school back when things were happening in Wisconsin and Minnesota, I remember the sad but terrifying pictures on the news at night as our tribal brothers and sisters were just enforcing their right to hunt and fish, and Minnesota went through some of that, and we have to be vigilant that we don't slip back again. We've done a good job, but I know that there's other states where it's still a constant friction. So you have my commitment to do the best that I can to make sure that you have a partner in the federal government to uphold the signatories to those treaties to do what's right. Thank you, Mr. Chair.
Right. Well, thank you for coming out today. By the way, I talked to the Secretary and indicated to him very strongly that he needed to contact all the tribes in the country and work with them, his people. So stay in touch with us. Let us know when that occurs, if it ever. Appreciate your being here today. You're excused. Our last group for today, Mark LeBeau, the Chief Executive Officer for the California Rural Indian Health Board. It's our first one. Hi, how you doing? Have a seat. Teresa, how are you? God, we're finishing up for the folks from back home. Dina Bove, there's Dina. And Eureka Eva Chase. Erica, okay, sorry. And you're all from Southern California? Oh, not all.
Northern California.
Northern California. 2 from Southern, 2 from North. Okay, great. Should we go ahead? Okay. All right. First, let's recognize you, Mark, for 5 minutes.
Great. Thank you, Chairman. My name is Mark LeBeau. I'm the CEO of the California Rural Indian Health Board. I want to thank the committee for the opportunity to testify today about the Indian Health Service budget. CRIB is authorized under the Indian Self-Determination Act to provide 638 contracted services to a series of tribal clinics throughout California. Our total membership includes 44 federally recognized tribes in the state. CRIB was founded in 1969 to work with tribes to assist in bringing back Indian Health Service funding when it was eliminated as a part of the process of termination in the 1950s that then segued into the 1960s, termination of tribes and federal Indian Health Services. As a result of termination, tribes and tribal clinics in California have been behind in ongoing priority setting and funding allocation over multiple decades. I would like to thank the committee for providing additional funding into the IHS system. About $500 million was allocated over fiscal year 2017 through the 2018 Consolidated Appropriations Act. I'd also like to thank the committee for providing $50 million for tribes and tribal organizations to receive opioid crisis intervention support. That funding's going a long way to assist the Indian country in remedying those types of issues. While the overall 2018 budget is $5.5 billion for the Indian Health Service, $15 billion or more is needed to actually bring the overall IHS system up to par with other standard delivery care systems. At this time, I'd also like to thank the committee for support of both the Northern Indian Youth Regional Treatment Center in California and the Southern YRTC. Critically important services. This committee has been steadfast in its commitment to ensure that those centers are built, are staffed, and are providing care to Indian youth in California. Critically important service. I want to commend the committee and then also thank Indian Health Service leadership for providing quite a bit of assistance in that regard. Now to a series of requests. Priority 1, the tribes and the tribal clinics that I'm privileged to work with in California respectfully request that the committee do everything in its power to ensure the California IHS area receives equitable construction and facility support funding. This can be accomplished by, among other methods, including language of the infrastructure bill that provides such equity for areas that are rarely serviced by the IHS. Language in the bill including forgiveness or absorption of federal loans. When tribal clinics are built or purchased in California will help provide equity to tribes. Another way to achieve this would be to increase the small ambulatory construction program funding, directing the IHS to lift its $2 million cap on each project. That's an imposed cap at the administrative level. It's not a directive from Congress. A national investment in federal and tribal construction funding is necessary. The California IHS area has received zero funding from the IHS Healthcare Facilities Construction Priority Program. The IHS has moved forward to build 10 hospitals, 25 health centers, and 11 housing projects for healthcare staff to live in areas other than the California IHS area. In fact, the only funded joint venture project occurred in Central California. All of the other 18 awarded joint venture projects are located in other regions and other IHS areas. These two IHS programs have provided substantial construction and facility support funding to a number of areas other than California since 1993. As a result, many tribes in California have had to borrow funding or collect donations to renovate community buildings, buy or rent new or used modular trailers or manufactured office units for use as healthcare facilities. Priority 2, we asked that the committee increase funding of the IHS Facilities Maintenance and Improvement Program to catch up with the amount of facility space in the IHS facilities inventory, including in the California IHS area. We respectfully request that the committee fund the IHS Facilities M&I funding program in the amount of $105 million. Third priority, we ask that the committee increase funding to the IHS Purchased and Referred Care program. IHS areas without IHS hospitals are termed PRC-dependent areas, and so there's a very special need that they have to ensure equitable distribution of that type of health care to tribes in California. Thank you.
Thank you. And next, Teresa Sanchez, Board Vice President, the Riverside San Bernardino Indian Health Incorporated. Welcome.
I'm Teresa Sanchez, I'm Board Vice President.
Oh, hit the mic. There you go.
I'm Teresa Sanchez, I'm the Board Vice President for Riverside San Bernardino County Indian Health located in Southern California. I'm also a member of the California Area Tribal Advisory Council and also a member of the Morongo Band of Mission Indians. Thank you for the opportunity to testify. We are thankful for the support of Congress and the funding provided to improve health status of our people. This is why it is so disappointing to see that funding for community health representatives, CHRs, has been eliminated for the President's 2019 budget. We are adamantly opposed to such cuts, as CHR program has been one of the most successful during our 50 years of operation. We also oppose the elimination of the health education program. Our organization provides services to Native Americans across 2 of the largest counties in the country. We employ 9 CHRs that are a critical part of our program. Each CHR is specifically trained in home health care and fill an important gap providing care to patients outside the doctor's office. For instance, CHRs ensure patients follow the doctor's orders, such as eating properly, taking their medications timely and appropriately, and exercising when needed. Talk through tough healthcare decisions with patients, direct patients to outside resources such as local food pantries or housing assistance. This list could go on and on. The loss of CHRs would simply be devastating to many Native American communities that are located far from clinics in the urban areas. We therefore ask for this committee to keep the CHR and health education program fully funded for FY2019 and thereafter. Another serious and long-term problem we face is the lack of construction funding. The 3 main IHS construction programs have largely excluded California tribes. Tribes often sit in the priority list for decades without ever receiving funds to build a new clinic. While the FY2018 Appropriations Act contained $497 million of new IHS funding, half was designated for joint venture construction projects and related staffing packages. No California tribes were approved for such projects, leaving almost no new money for California and no associated staffing dollars. Indeed, only 1 California tribe has ever participated in the joint venture program, and that was many years ago. Why? Because IHS developed the selection criteria without consulting with California tribes. Additionally, the 2017 Appropriations Act capped funding for the small ambulatory clinic program at $5 million, so no California tribes received grants from the program that year. We appreciate that the subcommittee has identified a $15 million for small ambulatory clinics construction in the FY2018 omnibus measure within the $243 million appropriation for healthcare facilities construction. Our request is simple. We need help getting construction funds to California tribes. We would like to see California tribes receive a share of the FY2018 small ambulatory clinic and other IHS construction funds to address healthcare facility space needs in our tribal communities. Lastly, we need help getting the BIA to complete a lease of our clinic land. We have previously expressed our concerns regarding the BIA's lack of responsiveness and delays in processing this lease. Congressman Aguilar, Garamendi, and the staff of Congressman Ruiz and Congresswoman McCollum heard our concerns and agreed to write a letter to the BIA. We thank them for their help in removing these barriers. I thank you for your time and consideration.
Thank you. Next, Dina Bouvet, Tribal Chairwoman, the Susanville Indian Rancheria.
Good afternoon, Chairman and the members of the subcommittee. My name is Dina Bouvet, Chairwoman of the Susanville Indian Rancheria located in rural Northern California. And I appreciate the opportunity to appear before you regarding fiscal year 2019 appropriations. I would also like to thank the members for their support of the fiscal year 2018 budget appropriations. Our tribe operates a large range of BIA programs under the Indian Self-Determination Act, Education, Social Services, Fire Protection, Johnson O'Malley, Higher Education, and Road Maintenance, to name a few. We also operate a health clinic via an IHS self-governance agreement, serving not only our own tribal members and other federally recognized Indians. We also provide access to services for other community patients. We are one of 2 health clinics in all of Lassen County that provide Medicaid services to patients. If you don't know Lassen County, it's a very large county, but it has a very small population because the entire county is very rural. So when you think of how large that county is and only having 2 medical providers that will actually, medical and dental, that will take on Medicaid patients, it's a lot of work. And this is vital to the part of of Susanville and Lassen County economy. Given my background in social services, first as an IHS community health representative, followed by other social services work, and now being the tribe's ICWA coordinator, along with the chairwoman, I will begin with asking that you reject the administration's social services funding proposals. Specifically, we ask that you please reject the proposed 37% cut in BIA social services. We estimate that we need at least a 140% increase in our tribal priority applications to keep up with the minimum needs. In the last 2.5 months, we've processed over 100 social services types of requests. Please reject the proposed 27% cut for the Indian Child Welfare Act. We estimate that we have an unmet need of over 300%, and an increase is needed to meet the minimum ICWA-related needs for our tribal children and families. We average over 12 active ICWA cases each month, and in addition receive 5 to 8 daily correspondence on ICWA matters that require a response to each county and or state. While we have worked with Lassen County Family Services in certifying a few native foster homes, this nowhere meets the needs, and many of our member and non-member tribal children are not placed in homes that are ICWA compliant regarding placement preferences. We also have a large problem in that there are several issues that concern the legality of how each state and or county treats our ICWA cases. This requires utilizing the services of legal counsel, again, creating a financial hardship on the tribe's ICWA budget. Please reject the proposal to eliminate the Johnson O'Malley program. This program provides valuable educational services to our tribe, including making it possible to have 3 to 4 tutors, after-school tutors. We are on track with increasing the reading levels, math proficiency, and cultural awareness of our children. Our program has grown within the last 5 months by 100%, and the students' grades have followed suit. These programs are vital to our tribe being healthy from our children on up. We ask that you keep funding the IHS Community Health Representatives Program. It is shocking that it is proposed for elimination. Speaking from personal experience, this is a very good program. And it, in fact, opened my mind to social work. This is the reason I spent 2 years as a social worker in our own facility. And this isn't just a medical program, this is a medical social worker. And you learn from there. Your doctor is helping, telling you what he needs you to do, but you're also bringing back those psychosocial issues that are so important for our tribal, our community's health. Please continue to support your support for construction of IHS and tribal health facilities. We were glad to see the significant increase in the fiscal year 2018 appropriations in this area. We are in dire need of a new medical clinic. We have one. We have outgrown our clinic and its footprint as well. There is no feasible way that we can update this very old facility. So we will need to be building a new facility. We have undertaken the planning and started feasibility studies. Finally, we join with others in Indian country in supporting the special diabetes program for Indians and wanting the funding for it to remain mandatory funding. We join with others in thanking you for fully funding contract support costs and ask that it remain that way. We ask that the IHS and BIA budgets be protected from funding rescissions or automatic sequestration of funds. Thank you very much.
Thank you. And last, to Erica Eva Chase.
Setia. Hey Ankele, Setia Nochsan, Erica Eva Chase Ahoya, Natinahwe Auchte, Hayal Shinikake Uho. My name is Erica Eva Chase, and I'm a citizen of the Hoopa Valley Tribe in far northwestern rural California, where I am the executive director of the Hoopa Tribal Education Association. I also currently serve as secretary for the Tribal Education Department's National Assembly, also known as TEDNA, a national nonprofit membership organization for the education departments and agencies of American Indian and Alaska Native tribes, also known as TEDS. Setia for the opportunity to speak today about funding for TEDS. First and foremost, our sincerest gratitude for appropriating funds to support TEDS through Section 2020 grants, especially for increased funding in fiscal year 2017. Today, tribal governments and TEDS are making historic progress in directing educational services for our people. Continued funding and increased funding is required to maintain and expand vital and successful programs such as Tribal Education Department grants, Sovereignty and Education Enhancement programs, Johnson O'Malley funding, and BIA higher education programs. For this, TEDNA respectfully requests $5 million at minimum to support TEDS in the Department of the Interior, Environment, and Related Agencies Appropriations Bill for fiscal year 2019, so that we are able to serve our Native American students who attend BIE-funded schools, other LEAs, and every facet of our tribal citizens' lifelong educational experiences, as I will explain further. The Natinahwe Hoopa people have educated their citizens from time immemorial, and for us and all tribes, education continues to be a sovereign right, a trust obligation, an issue of local control, and a sacred responsibility. According to the Northwest Evaluation Association measure of academic performance testing, in our local school district, nearly 71% of our Native American students are currently performing at low or low average in every subject matter. It is apparent that our tribal students and those across Indian country need and deserve better coordination and collaboration between LEAs, BIE-funded schools, and tribes for their student success and personal growth as our tribal nation's future leaders. TEDS are in a unique position to reverse the historic negative outcomes for Native students. Through Section 2020 grants and other initiatives, the important work of developing tribal education codes, policies, and standards pertaining to curriculum, personnel, students, facilities, and support programs are underway. In my experience as education director of the Hoopa Valley Tribe, I can attest to the value of building these relationships with LEAs and SEAs, and also the importance of asserting our tribal sovereignty and authority of education as it pertains to our own tribal citizens, recognizing many interventions, preventions, services, and strategies to enable student and family successes. Most recently, many of the previously stated poor performance academic statistics have been directly correlated with adverse childhood experience scores in our community. And there is now recognition that trauma-informed and culturally responsive techniques must be built into curriculum and instruction models that are offered to our students to enhance their resiliency and social-emotional wellness before they can achieve academically. Through Section 2020 grants, tribes like the Leech Lake Band of Ojibwe in Minnesota and the Pueblo of Acoma of New Mexico have both utilized that funding to identify community-based approaches to develop tribal education codes, comprehensive education plans, and also pursuing meaningful consultation to result in data sharing partnerships to address academic achievement and truancy and tribal participation on both planning and budget committees. STEP grantees have also taken on the realization that many state education agencies do not have the expertise to provide training or technical assistance that meets the unique educational and cultural needs of Native American students, and the Nez Perce in Idaho have filled that void. The Gila River Indian Community in Arizona, an SIE grantee, has for the first time in 20 years had the opportunity to gauge their growth and progress in 4 specific assessment areas and are now in the process of developing standards for school operations and performance, as well as school accountability to the community. The Section 2020 grantees are only just beginning to demonstrate the positive impact they can have in Native American education. We want to continue our important work and build on our fledgling success, and continued and increased funding will help us do that. Sustained investment in TEDS is sound federal policy. It is efficiently focuses on maximizing scarce resources for a historically underserved population. Direct tribal involvement in education eliminates undue bureaucratic barriers and streamlines administration. It encourages and supports local control and tribal self-determination in education. Thus, this subcommittee is presented with a unique opportunity to continue to increase tribal involvement, leverage the expertise of TEDS, and provide support in furthering these goals to help generations of Native American students. The education of our people is a sovereign and fundamental right, as well as a trust obligation. We must have control in shaping the experiences, outcomes, and planning of education that guides our people in their birthright as the leaders of our tribe. TEDNA respectfully requests $5 million at minimum for TEDS in the Department of the Interior, Environment and Related Agencies Appropriations Bill for fiscal year 2019, so that we may continue the vital work being done through Section 2020 grants, SIE, and other programs like Johnson O'Malley grants, and increasing the tribally controlled scholarships for post-secondary education. With these things in place, our tribal nations can realize the promise of local control and quality education as embodied in the Every Student Succeeds Act. And by investing in TEDS, we will see the benefits of meaningful tribal consultation realized as required under Section 8538. For we are the best advocates for the benefits and successes of our Native American students and the future of our tribal nations. Setia.
Okay, thank you, and thank you all for your testimony. Happily, we started TEDS at this committee a couple of years ago, so I'm happy to hear that it's working well. Just need more money.
Please.
But I hear that a lot.
Lots of
we
work
need
to
more
do.
money. So we try to do the best we can with the resources we have. Ms. McCullough and I were able to get a little boost last year, so we've been able to help in some ways. We'll hope to help a little bit more this year. We'll do the best we can with the resources we have. Obviously, California is a big state, has a lot of obligations, and I know you all, and down south, we have a lot of Indian tribes, Morongos. I know quite well. The tribal chairman's a good friend of mine. A prior tribal chairman was a good friend of mine, and so and Pachanga and all the rest. I hope you all work together. It's one thing we all talk about is getting the various tribes down south to work together, and I don't know. In Northern California, you're kind of spread out, so it's more difficult. I've been up in that area. It's hard to believe California, when you're as big a state as we are, that many people we have, but there are some rural areas, almost as rural as areas in Minnesota. I mean, it's a big state. But we certainly appreciate your coming here today. We certainly heard what you had to say, and we'll do everything we can to help. Ms. McCullum?
Thank you, Mr. Chair. I mean, you reinforced what we heard from rural tribes and tribes in urban areas, and but the focus on really how we have to keep listening and working together to achieve the goals of healthy populations, healthy communities, healthy nations, plural, is really on track. And that includes education. So thank you all.
Thank you, and let's see, I want to make sure, Dr. Badeau, we've been concerned with past GAO reports suggesting that the purchase referred care dollars might have been unfairly allocated. That's why we're focusing attention on the Indian Healthcare Improvement Fund,
Yes.
which is designed to fix funding disparities across the IHS system. And so hopefully that will fund, help California tribes. Would you concur with that?
Yes, Chairman, I want to thank the committee for providing funding to the Indian Healthcare Improvement Fund in the 2018 budget. I serve on the work group at IHS to assist in identifying a formula to distribute that funding in an equitable way across all IHS areas, taking into account unique needs such as the need for additional PRC funding to tribes in California, and we continue to work on that. Be glad to give you a report on that. We are meeting next week in Denver. I'll have more information coming out of that meeting.
Great. If you can pass that on to the committee, that would be very helpful. We have to go down and vote, so we appreciate your attendance. We're adjourned for this evening. We'll reconvene tomorrow morning.